That was interesting. And now my guest is Leanne Smiley. And that's a very appropriate name because every time I see this lady, she is, in fact, smiling.
Good morning, Bob. Thank you for the introduction.
It's so nice to see you.
It is nice to come on again.
Leanne, you are the Home Health Administrator.
I am.
And I want to ask you right on the top of the program, I was watching TV the other day, and there was an item on flu. Mm-hmm. And it seemed like this talking head was mentioning the fact that there is a mini or minor flu epidemic. What's the status here at Green Spring?
Okay. What is being reported in the media at the moment is an increase in flu cases across the country. So every state is seeing some type of increase, which often happens at this time of the year. Maybe we're a little later this year, and we think maybe that was because we've had a very mild winter in comparison to some. But it definitely is now upon us, and it's something that we need to think about, because here at Green Spring we are starting to see some residents who are either seeing a physician because of the flu. Unfortunately, some are also ending up in the hospital because of the flu. Yeah. And that's where we're getting a few patients coming back who have been diagnosed with flu. And unfortunately, what happens is when you're older, you get the flu, and sometimes that goes on and becomes pneumonia. And so then someone gets weakened, and it takes a long time to bounce back from at that time.
The flu shots that most of us had earlier this year, or last year, does that take care of all types of flu?
It doesn't always take into consideration the different strains. This year they believe that the flu vaccine is actually a very good flu vaccine, and it is encompassing most of the strains that are out there. Unfortunately, not everyone has a flu shot, and even though they were offered earlier in the season, they're still available. So if people still want a flu shot, head to your primary care physician, head to our medical centre, and they'd be happy to help you out. And in fact, the CDC recommendation at the moment is that people still go and get a flu shot, even if they haven't had one at the moment.
If people are on Medicare, Medicare takes care of the cost of the shot?
It does, because again, when we're looking at it from a public health perspective, the groups that are most vulnerable with the flu are young children and older adults. And so our population here at Green Spring definitely falls into a risk category. And so we do a lot of things here at Green Spring to help prevent the spread of any type of contagion, including the flu. It's why you'll see outside our dining rooms the hand sanitizer. Yeah. Before you go eat, use that hand sanitizer. It's available in all the bathrooms, the public bathrooms, again for the same reason.
I am saddened to say that I have noticed several people in a crowded area do not use the
etiquette, the cold etiquette.
And the coughing comes out. And with the age group that we have here, this is terrible. Not to cover your mouth.
I think, we all think of our own health and how our own health affects us. Unfortunately, when you live with a large group of people, and not that you're, with that group of people all the time, but you do mix with people in the dining rooms and in the activity areas, you're not thinking just of your own health, but you should also be thinking of those around you. And the recommendation is that if you are going to cough, that you cough into a tissue, and if you don't have a tissue, that you do exactly what you just did to again prevent those droplets spreading into the air, because colds and flu spread by droplet infection. So it is the coughs and the runny noses and touching on surfaces and that will help to spread.
Leanne is a home health administrator. Now just tell me, what does that home health administrator do? How many people are within your purview? Where are you located? Okay. In that order.
In that order. I've got to remember that order. So as a home health administrator, I'm responsible for the overall running of the agency with the state for compliance. So in fact, when state surveys come in or there's any questions from the state about what's going on in either home health or home support, I would be the direct contact that the state would make for that. I do have a wonderful support in an alternate administrator who is here when I'm not here, and Shirley Stewart, the manager for home support, is the alternate administrator. My direct responsibilities on a day-to-day basis are for home health. Shirley does home support, I do home health. But we both work very, very closely together because, as I said, both of us are responsible for the overall running of both of those organisations. Day-to-day, I manage the group of nurses and therapists who are working under the Medicare benefit. I'm managing that Medicare billing, I'm managing the office functions of that.
Are you responsible for responding to Medicare for all the many rules and regulations that they present?
Absolutely, and this year is a year of change. In fact, we saw some major changes in the way we report our information at the first of the year. So all our staff are now using new forms with new questions on them. And then in the middle of the year, we're expecting a complete update on our regulations. So we work under what are called conditions of participation, and they're the rules that Medicare sends out to and expects everyone to follow. Those conditions of participation haven't been updated for 17 years. The new ones have just been released, and we're going into effect the 1st of July, I believe, on that, or mid-July. So that's going to mean a change in not so much the way we provide care, but in the way that we manage our quality improvement. That's a really big change that's coming with that.
So you're going to have to restudy?
Always, it's a constant study. And when you work in a highly regulated industry, you can't rest on what we did 5 or 10 years ago. And I've been in home health for quite a number of years at this point in time. And what we were doing and how we were working at that time is definitely not how we're working anymore. There's a lot more constraints on what we do. And unfortunately, it's not till someone experiences a sudden onset of illness or an episode of where they need home health, that they suddenly realise that, oh, I might have had home health 5 years ago, why can't you do the same thing today? And we can't do the same thing today. It's very different.
Your home health people, don't they all wear the same top or green?
No. So my nurses and therapists in home health do not. They wear street clothes.
Yeah.
Again, we're going into people's homes as professionals, and we want to be able to work on a comfortable relationship. Some of my nurses will wear a white coat, but generally my staff are, in their everyday clothes. The green tops that you see around campus are the aides that work for home support.
Can I call those caregivers?
They sure, yeah.
Okay.
And so what you will see is the green tops are the aides who work in home support, but you'll also see blue tops. And the blue tops are our companions. So again, they're not aides and they're not doing any hands-on care, but they provide companion care. And both of those groups work under Shirley in home support.
Now, Leanne, I want to call you on a phone. What's your number?
703-923-3121.
3121. 923-3121. But I don't want to call you. I want to visit you. I want to talk to you. Where do I go?
You know what I just gave you? I just gave you my fax number. So actually I need to give you the phone number, which is 703-923-3123.
3123.
It's just that last number, but it was funny. I was thinking, I think I just gave Bob the fax number. But if you would like to come visit us, we'd definitely like to see you down in our area. We're in the terrace level of Village Square.
Oh, Village Square, okay.
So we're actually in Forest View, so you would have to go over through Village Square, past the old Resident Life Director office, because that's now dining. Keep going past Philanthropy. You cross the little bridge and there's an elevator there. Take that elevator down to terrace level, and then as you get off, you just follow the signs all the way to home health.
Okay.
And we welcome any visitors.
Very good. Any other updates before I say so long?
You know, there's always updates that we can
Okay.
provide. You know, again, you know, our staff are out there working with people in the community and definitely want to be of assistance where they can. You know, there's always that confusion about whether it's home health or home support that exists.
Yeah.
And I think, you know, the basic rule is if Medicare is paying for it or insurance is paying for it, then it's home health. It's certified home health.
Maybe we ought to have home health and home support on the program so that we can discuss the differences between the two.
I can definitely arrange that because I know home support comes up and does a separate time, but definitely we can do that. And again, you know, there's not a lot of differences. We still follow a lot of the same clinical rules and our standards are the same and our hiring standards are the same in both groups. It's just really who's paying for services.
Well, you gave us a thumbnail sketch, though, of your responsibilities, and I appreciate that, and I'm sure our viewer does too. But I want to thank you for
Thank you so much,
coming
Bob.
on.
Always.
It's always a pleasure.
It is.